it is time for our sponsor perspective portion of our program. Please welcome Paul Pazan, retired Chief of Police at the Denver Police Department, for a personal story.
Thank you very much for allowing me to be here in the first place. I also want to thank The Hill, an organization that I am passionate about, NAMI, both the national organization and our local affiliate in Denver. I want to thank each of you for being here, as well as those that are joining via live stream. We know that we need to start with why, and I'm going to start with why. I'm going to talk a little bit about the how, and then I'm going to end with why. But why we're here: mental health is real, and finally people are starting to get that. How I got here in front of you is, law enforcement is seeing a lot of these calls for service, and in Denver, we really leaned into this issue working with NAMI. Every single officer in Denver is CIT trained, crisis intervention techniques. We could have easily rested on our laurels and said, hey, this is how we respond to mental health calls and everything is fine. But we realized that wasn't enough, that there are outcomes for individuals in crisis that have been negative for the individual, negative for families, and we need to figure out how to do better. So rewinding the clock a little bit, Denver was early adopters of what's called a co-responder program. This is where you pair a mental health professional and a police officer together to address high acuity violent calls for service, or calls for service where an individual is armed with a weapon but is in crisis. We saw immediate success with that, and co-responders are a program that many departments, many cities, many municipalities, counties across the country have adopted. That's great, but what about low-level calls for service, and calls for service where that uniform can actually escalate the situation? In Denver, I'm very proud of our efforts that we were working on a community-based response dating back to May 5th of 2014. Almost 10 years ago, listening to our community. At one neighborhood in particular that had very high rates of mental health challenges, highest in the state, as well as significant issues with poverty and inequity. So what we did is figured out how can we change this paradigm. This was some of the precursors to something that is widely known now as the Denver STAR program, Support Team Assisted Response. This is now mental health professional with a paramedicine professional, no police officer whatsoever, to address the nonviolent, the individuals that are in crisis that aren't armed with a weapon, and help people. Again, great success. We launched that program June 1 of 2020. A lot going on June 1 of 2020, but there was about 2.5 years of prep work in order for us to get that going. 30 days later, we launched the third part of what we call the continuum of crisis care. So this is where we have outreach case coordinators or social workers that then do the follow-up. So if Paul is in crisis and I'm violent or armed with a weapon, that's a co-responder call. We respond to that situation, we de-escalate it, get Paul the help that he needs, and high fives, everything is great. If Paul is unarmed, nonviolent, that is a STAR team call. De-escalate, get Paul the help that they need. But what happens next week? What happens next month? And that's what the Outreach Case Coordinator program is, to do that long-term sustainable help for an individual to get them the help that they need, the support that they need. That way 911, 988 isn't responding to Paul's needs every other week. Very proud of those efforts, and we continue to build that. We have something called called the Assessment Intake Diversion Center that helps divert folks out of the criminal justice system very early on in the process with absolutely no criminal case whatsoever. All of that is great. Very, very proud of our efforts in leaning forward to address this challenge that we have, the challenge of our lifetime in our community. Now, that's a little bit of the how, but the why. 16 months ago, as the police chief in Denver, I had to call 911 for a child who had his first mental health break. But this occurred 1,000 miles away in a city, very progressive city, that I assumed we could get the help that they need. I'm a person of means. I have that police chief's cell phone programmed in my cell phone. I know how to talk to the officer as they're responding to the call for service, and I did that. I spoke to the officer before making contact with my child, who was in as bad of a break as you could ever imagine. And I asked, do you all have co-responders? Do you have a mental health professional that can help my child? And to my dismay, the officer said, co-responder? What do you mean? I said, a mental health professional that rides with the officer to help de-escalate the situation. And the officer told me, if I had one of those, I'd throw him out of the car. I'm like, this is great. This is the person who's going to go talk to my child, first break, never had any type of mental health challenge like this before. It took 3 days, 3 separate times of trying to get my child the help that they need. And finally, that occurred, and we're in a much better position today, a much better place today, so I'm very thankful for this. But the timeline, 16 months ago, that was before 988 existed. And so I could not be more thankful that the Hill, NAMI, that all of you are here today, because we need to get 988 out there in our lexicon. It needs to be as widely known as 911. It needs to be as widely known as what's the 411, and this is how we can help get people the help that they need. Now, all of this is important. It's critical that we get the awareness built up around 988, and we also have to look at models, as many of the speakers have talked about here before, of building up these structures, building up those responses that can help individuals in crisis. Our North Star for everybody in this room, everybody that's watching, for all of our communities, is better outcomes for individuals in crisis. That should be nonpartisan. It's not a political party. If it can affect me, it can affect anybody in this room. And that is why we have to continue to work towards these goals to help individuals get the assistance that they need, to get the right response for the right call. We've made a lot of progress, and 1 year is a lot to celebrate. There's a lot of progress that has been made. There's a lot more to go, and I'm thankful that both the Hill, NAMI, and all of you in this room are helping to get that message out there. One last little bit of personal privilege I would love to just share. Please also support your NAMI chapters. Right? I told you that my personal situation is much better than where it was 16 months ago, a year ago. But that long-term support that the individual in crisis needs, so do families. And I was sideways a year ago. I had no clue what I or my family was going to do in this situation. And fortunately, the president of our local chapter and I had a conversation. His story was remarkably similar to my story. He just experienced it 10 years in advance. So somebody that you can lean on, somebody that families can lean on, because this does not only impact an individual with a diagnosis or an individual that is dealing with this lifelong health issue, it also impacts families. So please continue to support NAMI, the great work that they do. Tell your friends, tell your neighbors, tell anybody that you know. 988 is a great tool. We need to elevate this number to help us in get those better outcomes for individuals in crisis. Thank you very much for your time.